We want to move swiftly into a very, very important keynote, and I'd like to acknowledge the presence of His Excellency, the Governor of Murang'a County, Dr. Irungu Kangata. Let's give him a round of applause. Wait, sorry, so before the round of applause, I'm going to invite Carol to invite him, but do you remember the round of applause that we practiced? Ladies and especially those of you at the back, we only have one go at this. So when Carol invites him, let's give him that round of applause. All right. Help me welcome to the stage, Carol Kamazaka, to invite our keynote speaker.
Thank you, Karaganya. His Excellency, Dr. Irungu, we are very privileged to have you here at our forum. And allow me to quickly introduce you as I invite you to give your keynote address. Dr. Irungu Kangata is the governor of Murang'a County and a lawyer with a PhD from the University of Nairobi. His political career spans roles as senator for Murang'a and MP for Kiharu. As governor, he has focused on strengthening primary health care and expanding digital solutions to improve service delivery and health outcomes. His Excellency, Dr. Irungu, you're welcome to give your keynote address.
Thank you so much for giving me this opportunity. My name is Dr. Irungu Kangata, Murang'a County Governor, and I will speak on 3 issues. Issue number 1, I will give you a context, what we do as a county government, because if I go direct into the subject, most of you may not understand the context of what we do and our flagships. Therefore, the first part will be mainly a little bit about the programs that the county has. Number 2, I'll then drill to automation and digital generally. Then number 3, I'll now go to digital health. What solutions Murang'a has, what problems and challenges we are encountering. And therefore, allow me to start with showing you a small video to show you some of the interventions we do on early childhood education. Maybe you can start. I don't know whether it has volume. If it can volume, okay. Fine. Now, one of the things we do in the county is renovation of ECDs. According to the Kenyan Constitution, early childhood education is devolved. So you can see the kind of early childhood education centers that were there before and our effort to renovate them through a program called community projects. And we have so far done 80% of the entire ECDs that we have in Murang'a County. That gives dignity to our children. Next, let us now go to the flagship. So on healthcare, we have a program where we give free medical insurance to the very poor. Murang'a has about 300,000 households. So we have given about 40,000 households who cannot afford their out-of-pocket payment for health insurance. That translates to about 160,000 individuals, assuming one household has 4 persons. So these are the benefits they get. Next, because of time, we have a telemedicine, which I will be explaining later. We skip that. We also have a mobile dialysis treatment. Murang'a, just like many counties, had a problem of insufficient dialysis machines. So we added some, then we also got a truck that moves from one health center to another, offering this service. The other one is expansion of hospital infrastructure, health centers and new hospitals. Then This one I will come later. We skip, which is automation. In agriculture, we have what I would basically call a subsidy program for for milk and mango farmers, where we give input support to those two value chain. But it's also technology based, meaning instead of us taking physical goods to farmers, we created a portal, a mobile app, where they go to an agrovet and they redeem those inputs, and we pay later on the agrovet. Then we have contract farming for sorghum with one of the leading beer makers in the country. We also distribute certified maize and fertilizer to 130,000 farmers. On education, in our early childhood education program, we give lunch program for all our ECD learners every day. Next is community projects, where we were the one I was showing you, renovating our ECDs. Also on education, if you are in a day school in Moranga and you are top students from number 1 to number 10, you don't pay fees. The county pays for your fees. The program is called Inua Masomo. Then on infrastructure, we know most of our markets have tarmac roads, so we have been paving those urban markets, cabros and tarmac. Okay, for a reason which I will explain later, power in this country tends not to be stable, so we have decided to solarize all our health facilities. We have 160 health facilities. We have so far solarized almost 100 of them out of the 160, including other county facilities like boreholes. Let me now finish this first part with this one called youth. This country has a huge problem of youth unemployment. So we came up with this idea, which was inspired with our reading of literature of good work that was done by an American president who was called FDR in 1930s in America. So this program, basically, we call young people in our county who don't have jobs, we tell them to ballot. If you pick yes, we give you the work to clean our towns. Every day we pay you 400 shilling, but 100 goes to your mom or your dad who doesn't work. And then, after they clean our towns for 2 months, we then take them to vocational training centers where they learn a trade. Some decide to become masons, carpentry. Then after 3 months, they do a vocational examination. Then thereafter, if they pass, we give them 15,000 as seed capital. Next, now, allow me now to go to automation because of time. Now, we have been doing a lot of digitization. This is revenue. We digitize revenue, meaning if you want to pay parking, if you want to pay single business permit, you go on the internet and you pay. You don't have to go to our county office physically. Next, automation is, this one is our hospitals. If you want to bring something to the hospitals, you want to tender, we brought e-procurement. Next is complaints. These are complaints. You have a complaint against the county, you again to go to a digital platform and we record you. This is a system to look at our solarization. Then this one, this one is teleradiology. Yeah, you know this country has very few radiologists. So when you go and an image is taken, the radiology receives the report digitally. He then puts his opinion and you receive your report digitally. Next is now the third point now, the final point. Murang'a County has digitized the entire health records. If you go to any Murang'a health facility, you don't carry a physical card. You just go with your national ID. What information do we get on our dashboard? Like now today, we have 4,154 patients now. In the middle there are the kind of diseases which have taken the people today, the main ones. There at the end, that's the collection, the money we have been paid so far, 330,000. If let's say SHA, Social Health Insurance Fund, this is the money we should claim for the services rendered today now. Here now is the lab test done so far, the imaging, the prescriptions. You can even drill down to a facility. If you go down up there, you can, let's say, just pick any, Kirwara. You pick Kirwara or Kegumo. This is the money so far and each data. So with this information now, what Murang'a now wants to do is now we have been having this system for the last 3 years since we came into office. We are now looking for AI systems, and we are happy. We are now planning to work together with the Gates Foundation to now put AI into all these systems, which will help us in better decision making, more accurate, and we are very proud of the journey. And also telemedicine. Let me give you now the final point of telemedicine. Murang'a is a very vast county, 2,500 square kilometers. We only have one main hospital, one called Murang'a Level 5. So people used to come all the way from up Murang'a up to down to seek that expertise service. So we brought in a telemedicine, meaning you just go to a certain small dispensary. The doctor who is in our hub gives you what we call the service digitally through a video link. You receive your prescription, and then you go home. You don't have to travel to Murang'a, and you save your money. We have Dr. Wendy, who is here. Can you be upstanding? She is the one. Yes, this young lady. She is the. Maybe you can come in 1 minute and say something how the hub work as we conclude. Thank you.
Thank you so much, Your Excellency. Good afternoon, everyone. My name is Dr. Wendy Kithu, in charge of the telemedicine program in Murang'a County. Our program runs under a spoke and hub model. So we have identified one hub where our doctors stay, and we have identified 13 spoke facilities, which are our level 2 dispensaries, and level 3, which are our health center. So we have identified 36 facilities. On a day-to-day basis, we are able to see patients from 15 facilities. We have a workload of about 350 to 500 patients in one day. For now, the program is entirely covering patients with non-communicable diseases, because that is the major issue in the county. We're very happy for the governor. He's really supporting us. Thank you so much.
Dr. Lishenga, a minute on the issue concerning digitization journey. Dr. Lishenga has been an advisor. He'll just speak for 1 minute, then we conclude. Thank you so much.
Your Excellency, I'm not sure what to say. I didn't expect this. This is an ambush, but it's. I would just say it's fantastic to see the journey that we have taken as Murang'a County in digitization. I think the point I would like to make is that we started by identifying what infrastructure we would need to put in place to make digitization work. So for example, not possible to digitize, to do everything we've done without solar. The solar had to be in place because power is unreliable. The other thing that has not been stated is internet. So Governor has said that Murang'a is very vast, it's very rural. There are a lot of places where broadband internet is not available, but through his leadership I think Murang'a is probably the only county where every single facility has Starlink. So this is amazing. So we put all those pieces together before we could put telemedicine in place. And so this has been the journey. Thank you, Excellency.
Thank you so much.
I think His Excellency and the entire county of Murang'a deserve another massive round of applause. Thank you so much. I think, honestly, Daktari, your leadership in all these initiatives, education, agriculture, healthcare, telemedicine, infrastructure, clean renewable energy, youth empowerment, digitization of government services, I really hope that, one, as a country, we can collaborate with Murang'a County more and learn from that. Thank you, Dr. Wendy. Thank you, Dr. Lishenga. And for those of you who are from other ministries across the continent, across the globe, please let us collaborate as well. Daktari, Dr. Irungu may not be here the entire conference, but members of his team are throughout the entire forum over the next 3 days. Let's interact with them, let's engage, and let's share ideas and grow together. Thank you so much, Your Excellency. Yeah, sure, one more time, another round of applause. Let's give it to him. Thank you. Thank you. Fantastic.